Ever wondered why some people have a higher concentration of red blood cells in their blood than others? The answer could be polycythemia vera. This isn't a simple case of being red-blooded. Rather, it's a rare, chronic disorder that involves an overproduction of red blood cells. Now you might be thinking, isn't more red blood cells a good thing? But in the case of polycythemia vera, this excess can thicken the blood, slowing its flow and leading to complications. You see, polycythemia vera is a type of blood cancer. It's part of a larger group of diseases known as myeloproliferative disorders, which involve the overproduction of blood cells by the bone marrow. This can lead to a host of symptoms and problems, and while it's a rare condition, understanding it is crucial. Because in the world of medicine, knowledge is power. Understanding polycythemia vera is the first step to managing it effectively. Now that we know what polycythemia vera is, what does it look like in a patient? Polycythemia vera primarily manifests itself through an array of symptoms that are sometimes subtle, often varying from one person to another. It's a chameleon of sorts in the medical world, making its detection a tad challenging. One of the common symptoms that patients with polycythemia vera experience is pruritus or itchiness. This is not your typical itchiness that can be alleviated by a quick scratch. It's often described as intense and is particularly triggered by warm water, making activities such as bathing quite uncomfortable. Another symptom that patients often complain about is a headache. This is not surprising since polycythemia vera causes an increase in the blood's thickness, making it harder for the heart to pump it through the small vessels in the brain. This can lead to a throbbing headache that can range from mild to severe. Dizziness or vertigo is also a common symptom. This occurs due to the same reason as the headache. The thickened blood struggles to reach the brain, impacting the balance centers in the inner ear, leading to dizziness. Fatigue is another symptom that can be attributed to polycythemia vera. The body's cells are deprived of the oxygen they need to function properly due to the thickened blood, leading to a feeling of constant tiredness and lack of energy. It's important to note, however, that some people may not exhibit any symptoms at all, making the disease even harder to detect. This is why regular checkups and blood tests are crucial, especially for those with a family history of the disease. In conclusion, polycythemia vera can present itself with symptoms like intense itching, headaches, dizziness, and fatigue. However, some people may not show any symptoms at all. Recognizing these clinical manifestations can aid in early detection and treatment of polycythemia vera. In the world of polycythemia vera, one key player often stands out, and that is the JAK2 kinase mutation. Let's dive a little deeper into this genetic mutation and its role in the development of this blood disorder. JAK2, or Janus kinase 2, is a protein that plays a crucial role in signaling for the production of blood cells. In a normal scenario, this protein helps maintain the balance of red blood cells in our bodies. However, when a mutation occurs in the JAK2 gene, it results in the JAK2 protein being constantly active, leading to an overproduction of red blood cells. This overproduction is the hallmark of polycythemia vera. The body ends up with too many red blood cells, leading to thicker blood that can cause a host of health issues, including blood clots and strokes. Interestingly, this JAK2 kinase mutation is not a rare occurrence in polycythemia vera. In fact, it's found in nearly all patients with the condition. This makes the mutation a significant biomarker for the diagnosis and treatment of polycythemia vera. Researchers and clinicians are continuously working to understand more about this mutation and how it can be targeted for therapeutic interventions. The hope is that by understanding and targeting this mutation, we can better manage and potentially even cure polycythemia vera. The JAK2 kinase mutation is a significant element in the development and progression of polycythemia vera. When it comes to diagnosing polycythemia vera, what are the laboratory findings and clinical presentations we need to be aware of? Polycythemia vera is a condition that's often discovered during routine blood tests. One of the primary laboratory findings is an elevated red blood cell mass. This means there are more red blood cells in the blood than normal, leading to a thicker than usual consistency. Such a viscous blood flow is a telltale sign of polycythemia vera. Another significant laboratory finding is the level of erythropoietin, a hormone that stimulates the production of red blood cells. In patients with polycythemia vera, these levels tend to be abnormally low, which is a bit of a paradox considering the high number of red blood cells. Now let's not forget about the JAK2 mutation, which is present in about 95% of people with polycythemia vera. This mutation, which we discussed earlier, plays a crucial role in the overproduction of red blood cells. Moving on to the clinical presentations, two significant signs are splenomegaly and thrombosis. Splenomegaly refers to an enlarged spleen caused by the overworking of this organ as it filters the excess red blood cells. Thrombosis, on the other hand, is the formation of a blood clot inside a blood vessel. This can lead to serious complications like strokes or heart attacks. These laboratory findings and clinical presentations are key to diagnosing polycythemia vera. Polycythemia vera is a complex disease, but understanding its basics helps in its management. We've journeyed together through the labyrinth of this rare blood disorder, shedding light on its intricacies. We learned how an increase in red blood cell production can cause a myriad of symptoms, making polycythemia vera a chameleon in clinical presentations. We delved into the enigma of the JAK2 kinase mutation, a common associate of polycythemia vera. This mutation, acting as both a culprit and a clue, aids in the diagnosis and understanding of the disease. Our exploration didn't end there. We navigated through the world of laboratory findings, highlighting how these tests play a pivotal role in diagnosing this elusive disorder. From elevated hematocrit levels to increased red cell mass, each finding adds a piece to the polycythemia vera puzzle. Remember, early detection and understanding of polycythemia vera can lead to effective management and a better quality of life for patients.